Yeah, so today there is a question to know which patient we need to transplant in acute myeloid leukemia. So as you know, recently there is an update of ELN classification. So the ELN classification determine and stratify the patient in favorable, intermediate and adverse risk. So usually you do not transplant the patient with favorable risk, with an exception with the MRD. So if there is not a good clearance of MRD, this patient could have a transplant in first line. And there is a question for the intermediate, and we transplant all the patients with adverse risk. So the question for the intermediate is because today we have new tools, and new tools is the MRD. So we could have access to MRD, flow MRD, NGS MRD, PCR MRD, depending of the characteristic of the disease, and the question is still open. So today the ELN recommend to transplant all the patients, all the intermediate one, and all adverse patients, but there is some question, and today there is a randomized clinical trial in intermediate AML patients with negative minimal residual disease, and we randomize the patient between allotransplant and chemoconsolidation alone. So for today, we need to continue to transplant, but maybe in the future, using MRD, we can decide to do not transplant maybe a small subset of patients. So the best factor to decide if you need to transplant or not the patient is, of course, the disease characteristics, so the molecular risk, as we discussed just before, but there is also the age, the characteristic of the donor, which transplant we can propose to the patient. The age is not a limit, but this is a parameter we need to consider to define if the patient could have a transplant or not, and maybe in the future the minimal residual disease.